How to become a nurse practitioner. Nurse practitioners are one of several types of advanced practice nurses who are important partners in the healthcare industry. They blend their clinical expertise in diagnostics and treatment with an emphasis on disease prevention and health management. Often a nurse practitioner works alongside a general, family or specialized practice physician to set up and analyze health screenings, diagnose illnesses, and prescribe medications. The nurse practitioner also grants doctor referrals and arranges for preventative health as well as manages follow-up appointments. Becoming a nurse practitioner requires education and licensing as a registered nurse, graduate education and certification. Becoming a registered nurse. Get a high school diploma. Admission into a school of nursing requires a high school diploma or, alternately, passing the General Education Development (GED) test. The foundation of nursing is science. If you don't like science but find yourself interested in nursing throughout high school, speak with your school counselor about arranging a day or two to shadow a nurse. Undertake post-secondary education in nursing. There are 3 ways to become a registered nurse. In all cases, coursework includes physiology, biology, chemistry, nutrition, and anatomy. Bachelor's degree in nursing (BSN). This level of education is awarded by a college or university and usually takes 4 years to complete. Class offerings more diverse than other settings and include community health, pharmacology, health assessment, microbiology, human development and clinical practice. A BSN qualifies you for a higher pay grade and a wider variety of certifications and promotions on the job. 3. Associate's degree in nursing (ADN). This is the most common way to obtain a registered nursing license and involves a 2-year program at a community or junior college. Many students transition to BSN programs after having completed an ASN and holding an entry-level nursing position. 4. Diploma from an accredited nursing program. You can also be eligible for licensure by completing a vocational nursing program. These accredited programs are often associated with a hospital and vary in length, though they are typically up to 3 years long. This education path is on the decline since the National Advisory Council on Nursing Education and Practice recommends that at least 66% of the workforce hold a BSN in nursing or higher. 5. 6. Note that you need a BSN to become a nurse practitioner. It is necessary to first become a registered nurse with a BSN before you can start a Master's of Science in Nursing (MSN) to become a nurse practitioner. With a diploma or ADN, nurses will be able to move on to their bachelor's degree through accelerated programs and potentially with the assistance of their employers via a tuition reimbursement program. You may also wish to earn a more advanced degree called Doctorate of Nursing Practice instead of the MSN. Make sure your school is accredited. The National Accreditation Agency for Nursing Schools is the Commission on Collegiate Nursing Education. This agency ensures the quality and integrity of bachelor, graduate, and residency programs in nursing. Accreditation is voluntary but ensures that colleges and schools providing nursing education are operating at the same professional level and educating future nurses in a manner which ensures that they can provide effective and standardized care. Get licensed. Registered nurses in the United States must have a nursing license. Take the National Council Licensure Examination Registered Nurse (NCLEXRN) once you have graduated from your accredited program. This examination is the nationally recognized licensing exam for registered nurses. Prepare for the international equivalent, such as CGFNS International, if you plan to work overseas or if you are an international student planning to work in the United States. Prerequisites to and fees for the exam may differ between states. Check with the requirements for your state, or for the state you plan on practicing in. Be aware as well that each state has their own scope of practice for nursing. It is important to know scope of practice so you know what you can or cannot do as a nurse in your state. Most states have reciprocal agreements, meaning that if you pass your exam in one state, you'll be able to apply for and receive a license in any other state without retaking the test as long as your license is free from any encumbrances, such as a felony conviction. Find a job as an RN, build some experience on the road to becoming a nurse practitioner by seeking entry-level work in a clinic or a hospital setting to get registered nursing experience. There are more than 2 million nurses in the United States, making the profession the largest in the healthcare field. There are a variety of settings in which a nurse can work, including hospitals, physicians' offices, elderly care homes, prisons, college campuses and schools. Image, become a nurse practitioner. Step 4.jpg Center. Entry-level work as an RN usually serves as a stepping stone to a higher-level career as an advanced practice nurse, like a nurse practitioner. You can also work as an RN as you pursue the further education required to become a nurse practitioner. There is great flexibility in being able to work as RN while obtaining advanced degree.